Hey guys, I wanted to do a quick summary of our discussion post for this week in lower quarter management. I hope you guys are all enjoying the long Labor Day weekend, and I'm thankful that we didn't get the hurricane. Had some really beautiful weather around here and was able to, get outside and have a good time. So great job on the post this week. This was sort of the intro week for back pain, and we talked about triaging and then psychosocial assessment, which sort of go hand in hand. The triage process is what we do with every musculoskeletal condition, but it's even more important in back pain because with back pain, we usually can't find a definitive diagnosis. So we need a triage process to help us with management. So the triage process would be ruling out the red flags. Once we do that, then consideration of like a risk profile to determine how intensive therapy does a patient need. Do they need minimal intervention? Maybe those low risk patients that are going to get better likely with the passage of time, and they need some reassurance, maybe some exercise, possibly some hands-on therapy, send them on, and then get them on their way. Are they medium risk where they're going to need, a more standard course of physical therapy, your 4, 6, 8 weeks, whatever it might be. And then your higher risk patients would be the ones that you're probably going to need to take more of a cognitive, behavioral, or what I like, or what the O'Sullivan group likes to call cognitive functional approach. Probably more applicable to us as PTs because we're not psychologists. And those are folks where we're going to need to explore more of those psychosocial type of issues. Now realize that triage process using the Start Back screening tool is not definitive. It's only a starting point. And you might even have patients that are low risk that have some psychosocial factors, or patients at medium risk that also have some. So don't automatically discount those patients that aren't high risk. That's why I would say you still want to do a good interview with all your patients to sort of probe for some of those psychosocial issues that might delay their recovery from back pain or interfere with their recovery. The article by Main, I think, is a really good one, particularly those questions at the end. I think that's an area where we all struggle, and you guys kind of commented on that on the discussion board. And I like the way those questions are phrased because it kind of makes it less invasive or less confrontational. So I would kind of start practicing those questions. You don't have to do all of them. You don't have to follow all the letters. Particularly it's not a work comp patient, I have to ask about that, but those are things to consider. And the ones that I frequently want to know about are what are the patient's thoughts on their diagnosis? What do they think's going on? Is there anything concerning them? Anything that they think might have been missed, or something that they're fearful of, or they're worried about. That way we can help to provide the appropriate reassurance and education to help them continue to move forward. So I really like those questions. The article itself is pretty well done as well. It's kind of lengthy, so I apologize for that, but I mostly wanted you to look at those questions. So I think everybody is on board with this approach, has an awareness of it. Now it's just executing it and putting it into practice. And then the next tricky part is identifying those high-risk patients or identifying those psychosocial factors. Then what do we do? And we'll talk about that in coming weeks. That's an additional challenge. So step one would be, okay, figure out which patients we need to take a different approach with. Step two would be, all right, how do we do it? And I think we've talked at length already when we did upper quarter, because that came up a lot in neck pain and other areas. So the same thing is going to apply to back pain, but we'll get into that in coming weeks. So great job on the discussion board. Enjoy the rest of your weekend, and we will be talking manual therapy and specific exercise for this week.